Welcome back to another episode of Kate and Isaiah Living Large. I'm Isaiah.
And I'm Kate.
And on this week's episode, we are going to talk about fat phobia and healthcare. But first, we are 1 week out as of the drop of this. Actually, we're not even a week out. We're like 3 days out when people will see this.
Oh yeah, that's crazy. Like we're destroying the illusion of us being a live show. It's never been live. But you can see us live and in person at the Port City Beer Run 2023
right.
edition.
That's right.
Coming up Saturday.
Oh my goodness.
June 3rd.
June 3rd. It'll be when this comes out, it will be that Saturday.
And we're making assumptions that people watch us the minute we drop every episode.
Well, when this comes out, it will be that's gonna be super exciting. If you're listening like on the Wednesday or Thursday.
Hi Melvin, hi Katie. I know
Friday.
you too, and Sarah.
You still have time to sign up. I don't think you'll have time Saturday morning to sign up, but hey, maybe you will. So we'll be definitely getting there. And we are getting ready to launch. So, as you know, me and my wife are very into the SPCA. We do a bunch with them. And we're getting to launch our second year of our Pup Pub.
Ooh.
So I'm super excited for that. So, for those of you who have never experienced it or don't know, what we do is we go to a brewery, one around the city or in the general area, and it's $5 cover. The cover goes towards the SPCA. We do 50/50s, and it's a good time. You can bring your dog. We always go to the dog-friendly ones, so everyone tries to bring their dogs. Lots of people bring their dogs that they've adopted before, which is awesome to see those dogs. And so this month, June will be June 11th. We're going to be at Foghorn, and we do one every month through to September. So
That's amazing, Isaiah. That sounds like a great event.
yeah, super excited for that as well. We've got a bunch of other SPCA events coming up in June, so I'm going to be excited to talk about those later on.
Yeah, that sounds great.
Do you have anything coming up in June since we're on the cusp of June?
I do. I mean, through my job, I work at CAA, and we're supporting Ellen's Ride in Sussex on Saturday the 10th. And then the PJ Walk for Ronald McDonald House on the 11th, which is happening in multiple cities. So that's kind of those are just positive events to follow and check out. I just happen to be part of an organization that's supporting them. I'm pretty excited about that. And other things, I can't think of anything right off the top of my head for June. I'm sure there's more.
There's probably a whole bunch, and I'm sure we will talk about a whole bunch of stuff.
Yeah.
Because like I said, we have a bunch of SPCA stuff that's coming up in June that we can't quite talk about yet.
Ooh.
And then hopefully...
Will you tell me? Just kidding.
We'll talk about that off camera, maybe.
Yeah.
And then hopefully in like a couple of weeks, I'll be able to announce all of the locations for our pubs, because we do one once a month, starting in June and then ending in September. So
That's awesome.
maybe we'll be able to talk about all of them.
I mean, based on your handle, Maritime Brews, I suspect this is an interest of yours.
It's just a little bit. Yeah. We started it last year, which was awesome. We decided to combine my love of beer and our love of the SPCA and all they do.
That's awesome.
To try and hopefully get some extra funding for them. And as well as we have pictures of all the dogs that are adoptable at a time with little blurbs of them. So
That sounds really amazing.
And then of course it's beer and dogs on a Sunday morning. So who doesn't want to do that?
Well, exactly.
That's
a kind of religion I can get behind.
But yeah, let's jump into our topic, fat phobia and healthcare. You really wanted to talk about this because you were talking about you've recently had experiences with it.
Yeah, and not in the way you'd think, not in the way that it's kind of I'm building it up to be. I haven't told Isaiah this yet. We like the reactions to be live and on camera for the shock factor. Yeah. No, as I've spoken about many times before, I've carried a lot of weight for a long time, and at my height, of fat. I clocked in around 445 pounds, as I've spoken about on this episode before. But what I haven't talked about is some of the treatments, medical treatments that I've tried in the past, even in the last year and a half or so. When we had Amanda on, she talked about a lot of the things that she'd been through, and holy smoke, she has tried a lot of things.
Yeah. And I really appreciate that she came on and was willing to talk about that stuff.
100%. It was great. And again, if anybody else wants to have a guest spot, we're open. I mean, if you're cool. You're not a weeb like Isaiah talked about last week. I'm just kidding.
I'm gonna start my own podcast talking weeb stuff.
Okay, have fun with your 2 viewers. Just kidding. I'm being punished. Karma's taking my microphone away.
The microphone is running away.
Yeah, so some of the things that I've tried in the past beyond diet and exercise is I tried, the happening drug of choice right now, Ozempic.
Okay.
About a year and a bit ago. And my doctor said I should try it out, and I was willing to try anything at this point. And it's really fun in that you have to give yourself a needle in the stomach once a week.
That does not sound fun.
No, I mean, you get used to it like you do anything else. And
I'm terrified of needles. So the thought of having to stab myself with a needle.
I'll tell you, the first time I did it, I was at mom and dad's house. So I was staying there briefly. And it actually was kind of funny because I was working from home that day, or working from mom and dad's house. And mom has studied to be a lab assistant in the past. And my sister's a lab tech. I mean, the needle doesn't go in your veins, but she's a person who's familiar with needles. And so that was fine. I was like, okay. So I kind of followed all the instructions, watched the YouTube video on how to do it. And it is really simple. And you have to stab yourself right in the stomach. So I'm there. It took me 45 minutes to even get close to putting that needle near me. And then I was like, Mom, can you do it for me? So I handed her the needle, and then she got this look in her eyes. I was like, no, you look too happy about stabbing me in the stomach. You're going to give me that back right now. Anyway, it took me a full hour. I was like, I have a meeting. I have to get this done. And it was completely fine. Stings for a second, but not even really. It barely noticed. It's a very short needle. It's fine. But there are some side effects with Ozempic, and there's a lot of make you feel not great and all kinds of stuff. But one side effect I didn't know about, I will say, I tried it and upped it to the max dose. So I tried it for a few months, and I found that I didn't lose any weight. And then when I read more and more about it, the weight loss kind of averages about 20 pounds a year or something.
Okay.
There is no miracle drug. No. There's no miracle of anything, but whatever. I was willing to try, because why not try anything? And I will say, I think it probably would have been different too if I was also heavy hitting on the diet and exercise at the same time. If these things had lined up, that probably would have made a difference. But as I have demonstrated, the diet and exercise has been making a difference without it. So that's fine on the Ozempic, but I felt miserable all the time. And I was not losing any weight. So I called the doc and I was like, this isn't really working for me. It's very expensive. I mean, I have coverage, so it would have been fine. But I'd like to come off it. And she said, sure, no problem. Stop taking it. Neat. Then I gained 50 pounds. And I never correlated those two things until relatively recently, because I was my lifestyle hadn't changed otherwise. So I couldn't figure out why I'd had a pretty significant weight gain really quickly within a couple of months.
Because your body got used to whatever the extra drug it was taking.
Right.
So when you took that away but didn't change anything, you pushed yourself.
Exactly. And then, so that's the 50 pounds that I've taken off this year, and we're all kind of square away again. But at the same time, we talked about plateaus last week, and I feel in the last couple of months, I've definitely hit about a 5-pound range, and I still have quite a lot of weight that I would like to lose, which brings me, after this long-winded explanation, I feel like I'm doing a soliloquy. Call me Hamlet. I went to the doctor this week.
Okay.
And to check in on my blood pressure, which is high, but stable. So good. Got another year worth of prescriptions. And yeah, so I had my blood pressure to check, and I said I wanted to tell her about the Ozempic and like weight gain. I said, yeah, so I gained some weight back, and she's like, yeah, I forgot to tell you that you'll gain any weight back. I was like, no, this was additional weight. This was new. This was new. And she's like, oh, that's not good. And then she asked me a question.
Okay.
Have you thought about bariatrics? Do you want me to put you on the list to talk to the bariatric surgeon? You know what bariatric surgery is?
I don't.
Okay, it's a where they take the fat out of your stomach and they cut your stomach, and it's like a pretty significant surgery. Yeah, it's pretty significant. They just remove a bunch of fat. I don't know much more about it than that, but people do it, and then they remove part of your stomach. Like,
okay,
it's a very significant thing. And she said the wait list to get into the doctor is about a year.
That's crazy. Okay.
It is, and I've always been, for me, anti-surgery.
Okay.
Because in my own head, I have felt like this is a mistake or a thing of my own, and I should be able to fix it myself.
I can understand where you're coming from that, but I think we all make mistakes, and whether it be that we've put on a bunch of pant weight, we started smoking, whatever, sometimes you need that extra something to help you move through. So I don't see it as being something wrong. Now I know for each individual person, it's definitely different in what you need to do, but I don't see anything morally wrong with doing it.
It's not a moral thing. And also there's a fear of surgery and risk associated with surgery as well. But what my doctor said next was so wonderful for anybody who's battled obesity. There's one thing to like have an extra 20 pounds that you play with back and forth. And that's one thing. That's, a lifestyle choice that you're carrying that extra weight or you struggle with. In some cases it's not. I'm not belittling anyone. For me, I have clinical obesity. It's something that I'm significantly overweight. I meet all the medical parameters to qualify for, that diagnosis. And this is what my doctor said. She's a young doctor, really, really excellent. I'm so impressed with her every appointment I've had. She's incredible. But what she said was, we are treating a disease. Obesity for a long time in medicine was treated like a lifestyle choice.
Right.
And I can tell you stories about how I have been treated like that, but we've treated it like a lifestyle choice. Like this person is choosing to be overweight. What we have determined over time that through physical, through genetics, and through mental health, depending on what combination of those factors are, it is a clinical diagnosis, and now we're treating it as such. So we're exhausting. You meet every criteria to meet with the surgeon, and you don't have to do it. That's entirely your choice. But with a year waiting list, why not get on the list and get it spoken to? But to be told essentially that the way I am wasn't my fault, when for my entire life I felt like it was, it was like almost a life-changing moment.
Yeah, that sounds amazing, because I know we've talked about, and I'm sure we both had the same experiences, although being a male, it's a little bit less than female, where, you go in and you're just like, I am in pain, and the doctor's like, well, yeah, because you're overweight. Instead of just like, well, maybe I have another diagnosis than just being overweight. Sure, that's might be a factor, but there's definitely more to it than just that.
Yeah.
Right.
Well, I had my previous doctor who had retired was also amazing and treated me very well and took me seriously whenever I went in with anything. And we would talk about talk about weight, and she'd encourage me to diet and exercise and all those things to try to get the weight down. Like I have no issue with my primary caregiver ever, but I did have an experience when it was before my last weight loss thing. I had an appointment with an OBGYN, the gynecologist, because I had to go to the hospital to have a regular woman exam done because I couldn't get it done in the doctor's office. And so that was fine. And he weighed me while I was there. And then my doctor told me that I had abnormal cells. And so I was there for like a follow up with him. And yeah, getting on the scale was awful because that was the first time I had ever known that I'd clocked in over 400 pounds. And this doctor told me, he said, instead of talking to me about potential diagnosis and treatment and things like that, I mean, there was some of that. Mentioned something about, oh, should I have a hysterectomy? And he said, nobody's going to want to do surgery on you. Do you realize that you're 200 pounds overweight? And I was like, well, yes, I do. But which was fine. Like, that's medically important for him to point out. But then what he said was, do you know what a pound of butter looks like?
Right. You've talked about that.
Yeah.
Yeah, that would be, yeah, that's terrible. Like, that's...
Well, and it was. And like, I don't think he intended it to be as terrible as it was. But like, most people know that you don't have to tell a fat person that they're fat.
Right. No, 100%. No, we know. We understand. We look in the mirror. We have fought it a lot of our lives.
But to be told that it wasn't all my fault.
Yeah, that sounds awesome. Yeah. And I think medically we definitely have come a long way. Like, again, not an expert at all.
No.
But like it even just bedside manner, it means a lot more now, and like how you treat your patient means a lot more now than what I think old school doctors were just like treat the thing and get it through.
And not all doctors.
No.
Like everybody, like I've had amazing care in my life, and really this was one incident. I know other people have had different experiences, but there is a bit of a fat phobia, as noted in the front of the episode, in the world.
Yes,
like beyond medical care as well. Like there's something, people do look at you differently and treat you differently. And I mean, I have major hangups about eating in public.
Yeah, sometimes like definitely there's times where you think about what you're eating and think about what people are looking around. I don't know if you've seen the video recently of the lady walking in the airplane. Have you seen that?
I haven't.
So there's a thing going on right now where there's talking about making airplane that middle aisle wider, and it's specifically because a bigger lady was walking down the aisle and just couldn't get through because the aisle was so skinny, and so it's a big topic right now going on.
Well, you know, and an airplane, and we've talked about travel before. I can totally see how if someone my size, or heck, even your size, is walking down the aisle and you're sitting in your tiny little uncomfortable airplane seat, I can see in your head reaction being like, oh, I hope they're not sitting next to me.
Right, yeah.
Like, I totally get that, because honestly, nobody finds traveling in an airplane comfortable.
Right, no. That's a whole big thing. We talked about traveling before, right? And then, of course, like, even going into like a restaurant, especially when we're talking about going into like walking into a McDonald's or a Burger King, that's like, you know, it's stereotypical, and you kind of sometimes it's the back of your head that I'm going into this place and that people are
judging me. They're looking at me and saying things in their own head like, look at that fat cow, like she needs this McDonald's.
Right.
The truth is, nobody needs McDonald's. Every once in a while, treat yourself. Life's about moderation. Cool. No judgment. I don't care. It doesn't matter. But and it's one thing somebody could say that's all in your head. Nobody's thinking that, but I guarantee people are,
definitely,
because people have said it. Not in that particular scenario. Although I've kind of a funny story, because why wouldn't I?
Well, why not?
A friend of mine and I we both carry some weight. We were working together at the time, and we ended up for lunch, and we decided we were both having kind of a bad day, and we decided to get like a really trashy lunch and then shame eat it in the car.
Shame eating in the...
And so we went through the McDonald's drive-through and got like burger and fries and the additional McFlurry, and we're both like sitting in the car eating.
Just raccooning it?
Yeah. Just like, and then doesn't like a pretty handsome sales guy who we worked with at the time like tap on our window like, hey girls, and we're like, why are you here? Let us shame eat in the car. And we were both so mortified that I think we both started health plans like within a couple weeks.
Yeah. There's definitely sometimes that shame eating. I want to eat this thing because it tastes good, but it's not good for me, and I'm just gonna go and squirrel away and eat it by myself.
And if you're listening to this episode thinking, well, if you're shame eating McDonald's too often, no wonder you're clinically obese. I don't do that for that often. And I have like compared what I've eaten to other people that I've been near who don't struggle with weight. And it just in my head, I'm like, why is this fair?
Right?
This just
Yeah,
isn't
yeah.
fair.
Yeah, some people can just like their metabolism's just like crazy and just eat all the things they want and everything and
Yeah.
don't have to worry about it. And they're like, why? Why are you still so skinny?
I just looked at a cheap piece of cheesecake and I gained 5 pounds. Like,
Yeah. And I mean, there's definitely some stuff on the other side, right? And I think we won't mention names, but I'm sure there's people that we know that struggle with the opposite side of things that
yeah,
are skinny.
absolutely. And this is the thing where it's just not okay to judge people.
Right. No,
Like,
exactly.
And fat or thin doesn't mean healthy,
No, right?
which is what's so great about what my doctor said to me the other day.
Yeah, and that's it's fantastic. I think that's definitely a great way to approach it. Is like, even though it's a clinical issue, right? And especially in the world we live in, it's not like healthy food is not approachable when it comes. That's not the word I'm thinking. Want to say approach. It is approachable in the sense of getting it, but it's cheaper to go to a McDonald's and get a meal, especially for like a family of 4. It's cheaper to go to a McDonald's and then to like try and eat healthy and
Well, there's a lack of education too. Like there's a whole lot of things that come into play, and it's not cheaper anymore to go to McDonald's like as it once was.
Yeah, it's not as
It's but it is cheaper to buy a bunch of craft dinner than it is to create healthy meals with vegetables and things like that. Unless you are like unless you know what you're doing. And what happens, I mean, this is an entirely other conversation, but there's like a whole discussion around obesity and health that accompanies poverty.
right.
And thankfully that's not what we're dealing with here. Like this is not the same
we
scenario.
We can
but
afford the setup to record and podcast, and
right.
so we're obviously not in that same boat.
No, we're coming from a place of privilege, but there is like that is actually a major contributor to lower income neighborhoods and healthy living and healthy eating. And if they can afford food at all, it's often easier and cheaper to get lots of things, canned goods and craft dinner and things like that, things you can make out of a box, fast food, like physically fast food, not like McDonald's fast food. And not to knock McDonald's, like not that they're listening, I don't want them to sue it. Like they serve a purpose in society.
Right.
And they do lots of, well, I mean, I shouldn't say lots of good things. They're a great capitalistic enterprise, but
they do things within the capitalism regime. Yeah.
Yeah. But, it is a very challenging thing when you don't know how to make a healthy meal.
Yeah.
And there are lots of people in that boat.
Yeah.
Aside, like I'm lucky to have been raised in a place where my mom knows how to cook very well and cooks very healthfully a lot. I mean, and I've learned, despite what you may think, Mom and Dad, I do know how to cook sometimes. I don't always just land on your door.
Yeah. And I mean so that kind of goes with with poverty and stuff, right? And the lack of that education of what you can make with food and stuff, and not even just poverty. Lots of us just don't know how to cook and clean and do all that fun stuff. And like, or in my case, I can cook. I know how to cook. Sometimes I just don't like making the decision on what to cook.
That's really hard. And that once you can afford it, that is making choices and cooking for one, which you do not have to do, but cooking for one and then doing the dishes and all of that stuff. None of it's easy, but it's the thing that, I recognize that when I'm not doing that, it's a contributor. Like if I'm being honest with you and me and all of us, that is a thing. Like cooking at home is better than eating out.
Yeah, for sure. Going back to the topic on hand.
Yeah.
Me and my wife were talking a while back about healthcare and medications, specifically around body weight. And something she had brought up is more has to do with Plan B. We talked about, but other medications sometimes people don't factor in that weight is a contributor to how much you're supposed to take. Plan B, for instance, it's based off of weight, and people think, hey, I gotta take one pill, and it's actually more, depending on your weight, you might have to take more than one pill. Things like that.
Well, I've never been, yeah, that's never factored in for me, but I even wonder, like, I've never taken Plan B, so it's not it's not something that I've ever really thought about. But what even makes, because when she mentioned that a few weeks ago, I started thinking about, I wonder if like a regular dose of Advil.
Yeah, Tylenol or Advil.
And I don't know. Like,
yeah, things that like we're over the counter kind of medicines that everyone thinks of one size fits all kind of medication.
Right.
That there might be there's definitely something to do with weight on those, right?
Right. And I mean, I have read the
label,
the small print, the label on these things, and they say adult child, but
what equates an adult to them?
Well, I know what equates an adult and a child, but like I was adult size when I was 12.
Right. So there's like medications that we don't think of that have to do with our body weight that definitely can affect how we react to those things.
Absolutely. No, it's really interesting. And then, I mean, healthcare is such a tricky thing because we're so lucky in Canada that we have publicly funded healthcare, that we can even have these discussions about having regular access to medicine and things like that. There's like if you're listening from the US or other places, that's not a real choice. That's not a real thing. And even being able to just try Ozempic for a while. Well, I have an excellent Blue Cross plan at my job, and I will say this is absolutely coming from a place of privilege.
Oh, for sure. Like that's 100%, right? Is the ability to think about what our medical is rather than have to worry about can we even afford to do the medical.
Right. Whereas like, oh, I can't go to the doctor unless I'm bleeding out because that's the only...
Right. It's going to ruin me.
It's going to ruin me financially.
Well, I can't imagine what it would be like. And that it's just, No, I am happy we live in Canada and have socialized healthcare.
Yeah.
I mean, our healthcare isn't 100% the best, but
no,
we are getting there. We're doing better. And I'm glad, like you said, doctors are looking at obesity differently.
Yeah, well, great. Because if it was, I mean, the truth is people are fatter today than they ever were.
True.
In the past. So if it was only diet and exercise, because the diet industry, which can be an entirely other topic, has made more money in the last, 60, 70 years than it ever has in the past, but people are fatter than ever.
Right.
So I don't know if I have the answer, but I sure like to talk about it.
High fructose, I can't even say the word
high
right
fructose
now.
Corn
high
syrup.
Fructose corn syrup.
I saw that documentary.
Yeah, that's syrup stuff. Corn. Yeah. Corn is the problem.
It's corn. It's got the juice.
Oh, TikTok. That is, I think
that's the end.
I think that means we need to wrap it up. We're getting a little hysterical over here. But this will be posted on Wednesday, right before the run. So if you're listening before the run and you're joining us, we'll be excited to see you at the run. Otherwise, where can people find you on the internet?
At Fat Caitlin on TikTok, at the Caitlin Dean on Twitter, Caitlin Dean on Facebook, and at Kated or Kate D on Instagram. What about you?
Well, I am Maritime Brews everywhere. And as well, you can find us on Facebook, Kate and Isaiah Living Large. And again, if you're listening on Spotify or anything, you can watch the video of us recording on YouTube. Like and subscribe on YouTube. Or wherever you're listening to your podcast, that'd be great. And again, comment, all that fun stuff. If you have experiences with healthcare, we would love to hear your experiences. And if you wish to be a guest at some point, please let us know.
Yep.
But other than that, we will either see you on Saturday,
June 3rd,
or we'll see you next week. Bye.